This is the stomach model with associated blood vessels that would be found in the abdominal cavity. So we'll start with just parts of the stomach and then work our way to some of the vasculature. Right here we have the esophagus that's going to be plugging into the stomach. So this portion right here is where we would have the gastroesophageal sphincter, also referred to as the cardiac sphincter. Has nothing to do with the heart, okay? But when you have acid reflux, we usually say that's heartburn. Okay? So that's what they're talking about. It's acid refluxing through this sphincter. This section would then be called the cardiac region. Okay? This rounded portion is the fundus. The middle section of the stomach is referred to as the body. And then the last section is the pyloric region. When you get to the pyloric region, you'll notice another sphincter. So it's an area of circular muscle here, and this is called the pyloric sphincter. And this is what controls the stomach emptying into the small intestine. So this portion of the small intestine is the duodenum. Inside the stomach, you'll see these ridges. These are called the rugae. And the rugae allow the stomach to expand. So as you fill it with food and liquid, it can increase in area. This is the lesser curvature of the stomach. And so you'll actually have a piece of omentum material that'll stretch from the stomach up to the liver. This is the greater curvature. And so your greater omentum will come off the greater curvature and go down over the abdominal organs. Underneath the stomach, you can see the pancreas running this direction, and you also see the continuation of the duodenum. Over here in the duodenum, we can see the plici circularis. These are the ridges inside. And then you'll also see the openings here. This is where the duodenal papilla is. And this is where the common bile duct opens into the small intestine, and the pancreatic duct opens into the small intestine. Looking at the vasculature, this large vessel here, and we'll see it again when we turn it around, but this large vessel, that's your descending abdominal aorta. And the first branch coming off of the descending abdominal aorta is the celiac trunk or celiac artery. This particular artery has three main branches. The first branch, so now I'm going to turn this around so you guys can see it. I'm going to go around this way. So three main branches. This first branch going up this way, this would be the splenic artery. This branch right here that's making a loop along the stomach, that's called the gastric artery. And then this branch right here is the common hepatic artery, which is eventually just becoming the hepatic artery that goes to the liver. Underneath the celiac artery, it's going to be a tough one to see, but underneath the celiac artery, where the stick is, that's the superior mesenteric artery. So it comes down this way. Okay, this is all superior mesenteric artery. Coming off the sides here, these are renal arteries, so they're going to the kidneys. For venous supply, we can see the splenic vein. Splenic vein, so the spleen would be sitting over here, splenic vein. We can see the gastric vein, the blue one, making the loop along the stomach. Inferior mesenteric vein. So that's merging with the splenic vein, so inferior mesenteric vein. Superior mesenteric vein coming up this way, superior mesenteric vein. And they're all merging together to form the hepatic portal vein. So it's this one here. On the pancreas, we can see the pancreatic duct. Okay, running this way. This is the accessory pancreatic duct. And then we can also see a portion of the common bile duct that's coming down from the gallbladder, which would be way up here. So common bile duct comes down this way. And then from the anterior view, if you're curious, We can see a portion of the superior mesenteric vein and a portion of the superior mesenteric artery.